Hi, this is my portfolio reflection for English 250. And this project helped me to dive more into something I'm concerned about. As we have seen, we are seeing more and more of a shortage of nurses. So I wanted to look into how this affects our nursing staff. And so it was more based on the mental health of our nursing staff. Um, and how concerning it is that we have an increased amount of patient population, but a decreased amount of staff. And so staff is getting very overworked, which leads to things like depression and anxiety and physical injuries. So this project let me focus on that a lot. Something though I would change when it came to doing this project is maybe the ability to have more time to work on it. I was working on it not as much as I probably should because I was dealing with my nursing classes, which are really heavy, and so it wasn't always easy to get my classwork done. So sometimes the English class would get brushed aside. Not necessarily that's a good thing, so that's why I would change that. I also would change the amount of time I had to kind of really look into it because I think I would have been able to come up with more information that would have made this memo even more appropriate for even a future staff writer. So when I chose this project, I was able to find out that um, I was meeting our institutional outcomes and our course outcomes just by doing the research and being able to put together the information and citing sources and understanding what are credible sources and how to use them, and being able to take multiple things and maybe take it down a little bit to make it into one big project. So I was also able to sit there and use the research that I found on our website and put together a memo that would be very beneficial even in my future as a nurse to give to a supervisor. So with that, I also chose communication as my workplace capability because communication is such a big deal when it comes to how we work as nurses, as just really as anything. And if we're not able to communicate our issues or concerns, that can cause problems in the workplace, and things cannot be done effectively or not in a beneficial way for our patients. And so it communication. I've found if you are able to communicate effectively with staff, it makes things go smoother. It makes people understand what you're talking about and why you are wanting to discuss this topic. So, in the end, I really am glad that I was able to do this project. It gave me some insight as to things I may be seeing when I am officially a nurse, hopefully at the end of August. And I can also sit there and understand what our nursing staff go through now, even in clinical, so that I can better help them as well to make their jobs even that much better. Thank you.